started wanting to be a nurse when I was about 9-10 years old. My grandfather, unbeknownst to me, was dying, and he had kidney failure and needed skin treatments every day. And even at the age of 9, when I would come home from school, I did all of his skin treatments, and because that was my papi. And so he always called me his little nurse. It just kind of became my goal to be one.
So I took care of my mother in her last days. Before she passed, she had cancer. And it's always difficult watching the one you love go through sickness, disease, pain. I saw her go from someone who's able to do a whole lot to someone who's not able to even accomplish the simple things in life for herself. So just that whole experience made me realize that I wanted to be that person who would be reliable to help those who are not able to help themselves. And currently, as an integrated care manager, remembering my why always ignites my passion.
When I was elementary, my father was dying of liver cancer, and I saw my mom. She was not in medical field, and I saw her struggling on how to take care of him. So right there, I said, I want to be a nurse. I was like probably 11 years old. Like every patient I encounter, I see them as a photo of someone's wallet. That's a very special person, that somebody cared about them very deeply. And it's a privilege and an opportunity to be able to care for them, and you're the only one there in the room, and you want that opportunity to be able to make a difference of their suffering.
I'm doing different projects to help decrease readmissions. What we're seeing is by having a discharge navigator role who can spend that extra time with patients, doing some teaching, answering questions, looking at their environment when they go home, that we've been able to keep so many of those people from returning in 30 days. And that's exciting. That's the kind of work I like to do, is things that help us meet our goal as an organization, but help to make our patients' lives better.
I have the ability to just hopefully inspire or make a difference to patient care and also my staff. I want them to be the best nurses and to help them to understand why we do what we do every day. Nursing is stressful and it's exhausting. Remembering your why often reminds you and gives you that boost that you need to do what we do every day.
You just can't explain the feeling. I mean, I still get teary-eyed sometimes, especially when the dads get emotional. That really hits me. Whenever they hear their baby cry for the first time and they know that that's theirs.
I was actually leaving one morning and there was a nurse getting in the elevator at the same time. She's like, no baby's born tonight, because there's a sound, there's a button we can push when there's a baby that's born, and it's a sound through the hospital. Sometimes we just forget to push it. And so we explained that to the nurse, and she said, I'll never forget, there was one night where at the same time that we were having a code on a patient and all the emotions associated with that, we had heard that there was a baby born because we heard that sound, and it was just like that balance of life and death. And she said that was, just like an amazing symmetry to be a part of.
I think when I first came into nursing, I was like, oh, I'm just a nurse. Like, I'm a bedside nurse, and that's my job. As part of the practice council, I was the chair last year, and we have made leaps and bounds strides in our quality data as far as keeping our patients safe. And I get to do that even though I'm a labor and delivery nurse. I'm helping make changes on the med-surg floors, changes that are like changing workflow, improving our patient outcomes. And my reason why I love doing what I do is that I'm making changes small and big just by showing up and caring.
I was an RN still on the floor, and then our director of nursing, she asked me if I could be the head writer for the Pathway to Excellence. And then learning the program, learning the designation, I just felt so engaged with it, and that you can do something to actually change the lives of the nurses. And education can be one way to do that.
I started working in the health center at the school, Ithaca College. And I started interacting with all the different roles of doctors, physician assistants, nurses, and I really started to see a lot of what nursing was doing. And I got involved working as a technician, basically at a local urgent care, and I got to be right in part of that team early on. And I just felt like I had access to people's lives, and I had access to really help. And almost in a sense, you get to be their guardian angel. You get to be the person they never met before. They don't know who you are, but you immediately develop a relationship. You immediately develop trust, and you're able to go in and you're able to help, improve that patient's care, improve that patient's life.
Medicaid in general, I don't think is easy for anyone to understand. And then these people with serious conditions in the community, just trying to understand what their benefits are, what kind of resources are available to them. And when they can call me and I can be like, no, we cover transportation for you guys. We can get you to DC to your appointments if that's what we need to do. I think that really kind of brings it, it grounds me. It makes me feel good about what I'm able to do for other people.
The why of what I do not just impacts what I do inside the hospital, impacts what I do outside of the hospital. It's about diversity, it's about inclusion, it's about treating people with dignity and respect, and that's kind of what we've always been doing at Sentara, and feeling that here has made it very easy for me to take that feeling to what I do outside of the hospital.
As the hospital DAISY coordinator, I read stories all the time about, nurses that are providing excellent care and going really above and beyond. Sometimes those DAISY stories help remind me that after all the meetings and all the other paperwork and requirements we have to do, we have to remember why we're doing this job. You made an impact, and that was the important thing.
Being able to bring a group of 22 people down 2 hours away to North Carolina, to a devastated area. You always train for it, much like in the ER, much like as a nurse in nursing school, you train for all sorts of scenarios and all sorts of diagnoses and problems. When the time comes and the phone rings, it's like, wow, we actually get to do what we've trained for now. It is so exciting, and it just really brings you back to just the core of who you are and why you're in this, and why you're, specifically for me, why I'm a nurse.
I was lucky enough to get to go down to North Carolina for the disaster hospital because of the hurricane. We really did very basic treatments, but to have that community that was just devastated, they had nothing left, to come and sit with us and talk with us, we really felt appreciated. That reinvigorated my passion for my career. I've always said there's an art and a science to nursing, and it reminded me that the art is the compassion and the love that you have, that you pour out into your patients, and that just isn't something that you can learn in nursing school.
Providing compassionate care, whether it's in the hospital, whether it's in the emergency room, or if I'm taking care of special needs kids, showing them compassion and love and care. That's just something that's always been important to me.
I always had this thing that I always want to help people, and that's why I truly, truly do love nursing. Every day is not great, but you know what? Some patients you may have may be a little challenging, but guess what? At the end of the day, you know that you've done your best for them.